Welcome back, my dear students. Today we will learn about the common cold, a mild but annoying infection caused mainly by the rhinovirus. It spreads easily through direct contact, droplets from sneezing or coughing or touching contaminated objects. There is no specific cure, but good hygiene, covering your mouth and washing hands can help prevent it. Let's see how healthy habits and awareness can keep the common cold away from us and keep us feeling our best. What is rhinovirus? Rhinovirus basically belong to the Picornaviridae family, small but mighty troublemakers. They causes the most common cold, a mild self-limiting infection of the upper respiratory tract. The good news, it usually goes away by itself in a week. So roughly the diameter of the rhinovirus is 30 nanometer and it has a icosahedral capsid. It is naked virus. Nearly 20 equilateral triangular faces are there. How does rhinovirus spread? Direct contact. Most common way the virus spreads through the direct contact with nasal secretions. Example, shaking hands with someone who is infected. Droplet spread when an infected person coughs or sneezes. Droplet filled with viruses can fly through the air and can be inhaled. Indirect contact or by means of fomites, the virus can survive for hours on things like doorknobs, toys or towels. Touch a contaminated surface. Touch your nose, mouth or eyes gets infected. Peak season. Rhinovirus loves early autumn and spring. Crowded places like school and offices help it spread fast. Pathogenesis. What happens inside our body? Entry. Virus enters through the nose or eyes, which is called as conjunctiva. Attachment. It attaches to a special receptor called the ICAM1 on nasal cells. Replication thrives at 33 to 35 degrees Celsius, which is perfect for upper respiratory tract. It stays mainly in the nose and throat. It infects the respiratory mucosa that borders the nose cavity. It binds with the ICAM1 receptor. What's the host response? Body's immune system goes into action. Inflammation releases bradykinin and histamine, causing stuffy nose and sneezing. More mucus, which promotes runny nose. Symptoms are mostly due to your immune system's fight, not direct cell damage. Symptoms and clinical features. Incubation is 1 to 3 days after infection. Common symptoms: sneezing, runny nose or rhinorrhea, nasal congestion, short throat, mild fever, headache, malaise, cough due to post-nasal drip. Usually clears up in 5 to 10 days. Basically symptoms is common cold 1 to 2 days after infection. It remains for around 2 weeks. Nasal congestion and irritation can cause a runny nose, sneezing, headache, sinus, ear or face discomfort and a loss of smell and taste. Management. How do we treat it? No magic pill, but you can feel better with good care. Rest and hydration. Drink plenty of fluids. Nasal decongestants, short term use to erase stuffiness. Antihistamines reduce sneezing and runny nose. Pain and fever relief. Paracetamol or ibuprofen for headache and fever. Cough remedies only if the cough is really bothersome. Antibiotics, no, they don't work on viruses, only needed if there is a bacterial infection too. How to prevent the common cold? Hand hygiene. Wash your hands well with soap and water. Avoid touching face, especially eyes, nose and mouth. Use tissues. Cover your mouth when sneezing. Throw tissues away properly. Disinfectant surface. Keep doorknobs, phones and toys clean. No vaccine. There are too many types of rhinoviruses and they mutate quickly. Summary of rhinovirus. It is the causative virus is the picornavirus. Primary cause of the common cold is the rhinovirus. It infects the respiratory epithelium. It causes disease via the nasal mode of transmission. Symptoms include runny nose, nasal congestion, sneezing, etc. We can clinically diagnose the disease. Treatment options include symptom alleviation, preventing the illness from spreading to other people. So I hope this class helped you understand rhinovirus infected common cold, how it spread, how vaccination stopped it, and why hygiene and isolation were vital. Stay informed, trust vaccines, and keep learning. If this helped, please like, share, and subscribe. See you next time. Thank you.